Namaste, this is Dr. Vinod here and I hope you're doing well. In this video, I'm going to speak about a very common condition that affects many of us, neck and upper back pain. As in my previous videos, I'm going to speak and give a brief overview of what causes neck and upper back pain and also list out some simple exercises that can be done at home or at your workplace to relieve this problem. So stay tuned and keep watching. So one of the banes of our modern lifestyle is sedentary work. We tend to spend a lot of time seated or in a sofa or a chair, and most of the time we are looking down with our head tilted forward. This may be things like using a desktop placed at the wrong height, using a laptop, using a mobile phone to send texts or to chat or just to scroll and browse, to read, to write at the desk, even things like cooking and chopping. Vegetables, for example, you're constantly looking down. What happens then is that the whole weight of your head bears down upon your neck, and this places a lot of strain on the neck. Imagine having to carry something or an object weighing 4 to 5 kilos throughout the day in your arms. It will be tiring, won't it? So that is exactly the weight of your head. And if you have to carry the weight of your head on your neck muscles, with especially the tilted forward position, that puts a lot of strain on the neck muscles, leading to issues such as spasms, muscle knots, and trigger points in the muscles of the neck and the upper back. To add to this, if you have a lot of mental stress, that makes the situation much worse and leads to more of the muscle spasm and the resultant neck and upper back pain. So what this posture results in is some of the muscles of the neck and the upper back being stretched and weakened, and other muscles being overworked and tight. This is far the most common cause of neck and upper back pain, and it causes a lot of functional pain and disability to people who suffer from it. Over time, if it's left untreated, then it can lead to a hunched or a stooped posture. It can lead to things like intervertebral disc displacements and herniations, and also degenerative changes or arthritis in your spine. Now, before I go any further with causes of neck and upper back pain, I thought we should cover the very basic anatomy of the spine. So the spine starts from the base of the head and extends all the way down to your tailbone. It consists of various segments. You have the cervical spine, which is the segment of the neck. Then you have the dorsal segment, which is the thoracic spine. And then you have the lower back, which is the lumbar spine. And then you have the sacrum, which forms a part of the tailbone along with the coccyx. So the neck bones, so the cervical spine, is made up of 7 bones, and then you have the thoracic spine, which is made up of 12 bones, and then you have the lumbar spine, which is made up of 5 bones. So the neck and the lower lumbar spine, they are quite flexible, whereas the thoracic spine, the torso spine, is relatively rigid and stable, and it sort of trades off flexibility with stability. And it's relatively more immune to any of insults and problems which normally affect the neck and the lower back. There are ribs which start from the thoracic spine and comes all the way forward, and it's connected to the breastbone, and hence this provides a cage for the heart, the lungs, and other important structures and blood vessels which are well protected by that cage, which is formed by the spine at the back, the ribs in the sides, and then you have the breastbone in the front. In addition to that, you have the bones which form the spine, and between the bones you have the intervertebral discs, and then you have the joints at the back. At every level you have 2 joints, and then you have a whole set of ligaments and muscles which helps to support the spine and keep it erect and the right posture. So whenever you have an increased load on the spine, the first thing that gets affected are the ligaments and the muscles of the spine, because they have to work extra hard to maintain their normal function. And then if you leave things be for a long time, then it starts affecting the intervertebral discs and also the joints of the spine. So how does this problem usually present? The most common symptom that I get to see in my practice is a dull achy pain that is present at the base of the neck, which can radiate down into the cape area, which is sort of in this area, or between the shoulder blades. The pain is usually quite a dull pain, which starts off as very mild initially and then gradually builds up over time. And the pain is usually felt most severe towards the end of the day after a period of activity and just before going to bed at night. Now, if the neck and upper back pain becomes bad enough, then it can even affect normal activities such as lifting a moderately heavy object, throwing a ball, getting things from the shelf, reaching behind your back, or even comfortably sitting or sleeping at night. Now, the risk of getting back pain, upper back pain and neck pain increases with increasing age. But apart from that, there are certain other associations, like female gender tends to get it more. Sedentary work obviously is more responsible for more of neck and upper back pain, and also mental illnesses and stress has been associated with neck and upper back pain. Now, as I said before, the most common cause by far for causing neck and upper back pain is increased stresses and mechanical overload of the neck and the upper back muscles in the spine. But apart from that, there are uncommon conditions which are more potentially serious, which can also result in neck and upper back pain. These are things like trauma, wherein you have an accident or collision followed by very severe neck or upper back pain. You can have a thoracic or cervical herniated intervertebral disc or a disc prolapse in common parlance. Then you have osteoporotic and compression fractures, which can happen as a result of age when the bones become thin and light. And then you have things like spinal tumors, deformities like scoliosis can sometimes cause mechanical pain in the neck and the upper back. And also you have new diagnoses such as fibromyalgia and myofascial pain syndrome, which can also cause a lot of muscle spasm, trigger points and knots in the neck and the upper back. So when do you need to get concerned when you have neck or upper back pain? One is if you have very severe unrelenting pain which is lasting for longer than, let's say, 2 to 3 weeks in spite of conservative measures which I'm going to describe after this, then you need to consult ideally a spine surgeon or see your doctor. If you have very severe neck and back muscle spasm and stiffness which is preventing you from even tilting or turning your head or moving around for your normal day-to-day activities, that should be taken seriously. If you have rapid unexplained weight loss, fever or severe headaches, then you should again seek early medical attention. If the pain is radiating down the arms, or if you have weakness in your upper or lower limbs, or if you have pain which radiates down the side of your torso along your rib up to the front, or if you have some difficulty in breathing and chest expansion, that is another indication that there could be something more serious than just a mechanical back pain. If any of these are present, then it's best to see a spine specialist or your own doctor initially, and then be referred to an orthopedician who specializes in spine. So what are the things that you can do at home when you have neck and upper back pain? First thing to do is to rest that part. So you should try and avoid the posture or the positions which can cause this neck and back pain. You need to rest the part by not lifting anything heavy, not doing anything strenuous. Avoid prolonged continuous sitting in a certain position. You can apply some ice initially for the first couple of days and then replace it with the local heat application in the neck and the upper back. You can take some over-the-counter medicines which are anti-inflammatories, which is also accompanied by muscle relaxants usually, which will help reduce the muscle spasm and the pain. Light massage and physiotherapy may be helpful in the early stages. But if you want to have a long-term solution of neck and upper back pain, then you have to make major modifications in your posture and also do some regular exercises, which I'll be demonstrating very soon. Things like smoking, quitting smoking has also been shown to reduce the chance of having spinal degeneration and spinal wear and tear, and also reduce the chance of having back pain and neck pain. Stress management is very important and to optimize the mental health, because that is also a contributing factor in increasing the intensity of neck and upper back pain. So let's move on now to the exercises, which are very simple and easy to do. But as I keep saying with any list of exercises, that there's no point in doing it for a couple of days and then stopping it. You have to be persistent and keep doing this every single day until you start seeing results, and then even after that continue it for a few weeks and maintain that as a part of your normal day-to-day activities. So what usually happens as a result of this constant hunched or stooped over position is that over time certain muscles become more contracted and certain other becomes more stretched and weakened. So the idea and the principle of doing these exercises is to strengthen those muscles which are weakened and stretched, and to stretch those muscles which are contracted. So the typical findings are that the muscles in the front are usually contracted. So you have the pectoral muscles, which are your chest muscles, which are contracted. So you tend to get a rounded shoulder, which is sort of leaned back in that way. And then you have some neck muscles which are contracted, so you tend to do that. So the muscles, especially the sternocleidomastoid, which is this muscle here, that tends to get contracted to bring your head forward. And then you also develop a rounded back. So if you look at the back from the side, you tend to have a hunched position like that. So you have a rounded back, a neck pointing forward, and a rounded shoulder with tight and contracted pectoralis muscles in the front, and you will have some weak muscles and stretched muscles at the back. So before we start off with any exercises, you need to do a slight warm-up. So there's a simple enough way to do it. You just need to move your head in all directions very gently and slowly, so you don't tend to get any crick in the neck. So you just need to look up, look down, turn your head to the right, turn your head to the left, look straight, tilt your head to bring your ears close to your shoulder, and tilt the other way. So these next two exercises are to stretch the muscles at the back between the shoulder blades and also just above the shoulder blades. So very simple to do. For the first exercise, you need to just cross your hands across your chest like that. Place your hands on the opposite shoulder, and then I'll demonstrate to you by turning sideways. What you need to do is to just hunch and bend forward so as to widen the space between your shoulder blades, and put your head down so as to stretch the spinal muscles, and hold this position for a few seconds. Almost curl down into a ball as much as possible, and then come back up again. So again, the same thing, just bend down and curl, hunch your shoulders forward, stretch the back muscles, hold that position for a few seconds, and relax. This will help to relieve all the tension and the spasm in your muscles, and also relieve any of the knots which are there in your muscles as well. The next exercise is just a variation of this. What you need to do is to just cross your fingers in front, turn the palm outwards, and then try and push your palm out, thereby stretching the back muscles. So when you're doing this, you feel the stretch at the back, hold that for a few seconds, and then come back to neutral. So these are the two exercises that you can do to stretch the muscles at the back between the shoulder blades. These two exercises are to stretch the muscles called the trapezius and the levator scapulae. Don't bother about the names. It's basically just the muscles which are connecting the base of the neck to the top of the shoulder blade. So these are the muscles which are commonly affected and go into spasm and create knots, and these are the muscles which usually cause the crick in the neck. So the first exercise is just to stretch the upper part of the trapezius muscle. So you just need to sit and then tilt your head to the side such that you try and touch the ear onto the shoulder. And when you do that, you'll feel the stretch at the base of your neck in this area. Hold that stretch for about 5 to 10 seconds and then come back to neutral. Do the same on the opposite side. Very gently tilt your head so that you try to bring your ear onto your shoulder blade. Hold the position for a few seconds and then come back to neutral. Now the modification of that to work the levator scapula muscle is to tilt your head, same as before, to one side, and while you're doing that, at the end of that range of movement, you just need to look down as though you're looking at an imaginary pocket on your shirt. So hold that position for a few seconds. You'll feel that you're stretching a different muscle, and then you come back to neutral. Same on the other side. Tilt your head and then look down as though you're stretching and looking into your pocket. Hold position and then come back to neutral. The next two exercises are to strengthen certain internal muscles of the neck and to stretch some of the muscles which are at the back of your neck. So the first exercise of these two exercises is called the double chin exercise. The name might sound funny, but this is exactly what we're trying to do. We're trying to create a double chin. I'll demonstrate that to you. What you need to do is to basically sit comfortably and then try and push your chin backwards or pull your head backwards so as to create a double chin. So if you can't do that because of weak muscles, what you need to do is just to goad your chin backwards by using the finger. So you need to press back and create a double chin and hold that position for about 5 to 10 seconds and then relax. So again, push back, create the double chin, hold that for 5 to 10 seconds and relax. And then you can repeat this maybe about 5 to 10 times. The next exercise you need to do is a slight modification of this. It's called the occipital stretch. Occipitalis is a muscle which is found here, and you need to stretch this muscle. So it's almost the same as a double chin exercise. You need to create the double chin by pulling your head backwards and then giving a slight flexion to your head. So basically you look down, and when you do that, you feel the stretch at the top here, and you hold that stretch position for a few seconds and then relax. So pull your head back, look down, and relax. The next exercise is to basically strengthen these muscles between your shoulder blade. What you have to do is to just place your arm by the side, try and take it backwards, and when you're taking it backward, try to rotate so that your palm faces forward, and then take it as back as you can. Feel the squeeze and contraction of the muscles between your shoulder blade, and you've got to hold this position for about 5 to 10 seconds and then relax back. So again, lift your arm up slightly off the sides, reach back with the palm facing forward, thumb facing up. Feel the contraction at your shoulder blades and then come back to neutral. This next exercise is called the WY exercise because you make positions which are similar to the alphabets W and Y. So you can stand against with your back against the wall like this, try and put the flat of your back against the wall, and then you get your arms out into this position. In the beginning, it'll be quite difficult to do this because you might have a slightly hunched back. So when you do this, you try to place the flat of your forearm as well along the wall. And then this is the position of W. If you notice, there is a W being made with the hand. So once you are in this position, then you can feel the contraction of the muscles at the shoulder blade, and then you've got to lift your arm up to get into a Y position. This brings to mind the YMCA song. So what you need to do is to just bring your arms down into the W position, feel the contraction, squeeze between the shoulder blades, and then stretch out into the Y position. So again, squeeze, hold for a few seconds, and then back to the Y. One another group of muscles that people often ignore when they work on the neck and upper back is the pectoralis muscle or the chest muscles. You have two muscles. You have the pectoralis minor, which is the deeper, smaller muscle, and then you have the larger pectoralis major muscle on the outside. So you need to stretch these muscles because when you have a hunched posture and a rounded shoulder, you tend to have a contracted pectoralis muscle. So for this, easy enough to do the stretches. You just need to stand against a door pane or the edge of a wall and put your hand back like that, and it should be just behind the plane of the chest, and then you lean forward and feel the stretch. So you can start off in the beginning with the arms placed like that, but then as you keep progressing, you can move it a bit higher up and then stretch forward. And once you stretch it, hold that position for a few seconds. You may even want to rotate your body to the opposite direction to give more of a stretch, and hold that position for a few seconds and come back to neutral. So repeat this exercise about 5 to 10 times on both sides, so that will help to stretch the pectoralis muscle. So those were some easy peasy simple exercises that can be done anywhere and can make a world of difference to your neck and your upper back pain. Remember that it's important that you're persistent with these exercises and also you try and improve your posture so as to prevent it from becoming a chronic problem and leading to further pain and disability. So that brings us to the end of this video. If you have enjoyed watching this, please don't forget to press the like button and also press the subscribe button to be notified of further videos coming up about various orthopedic conditions. So as always, keep moving, keep fit and stay healthy. Until next time, this is Dr. Vinod signing off. Namaste. If you liked this video or found it useful, don't forget to like, share and subscribe. And if you want to be notified of further videos coming up, please do press the bell icon which is next to the subscribe button.